Welcome to another episode of the Granite List Live, where we discuss all things related to employee benefits and human capital. I'm Lee Dill.
And I'm Sally Pace. And today we have two distinct gentlemen on the show bringing us some big news. So joining us, we've got Nick Patee, the CEO of Workrite, and Curtis Smith, Chief Customer Success Officer for Medcor. Two different companies, but one big announcement. So guys, I want to ask one of you to kick it off. We've seen the news recently about the partnership between Medcor and Workrite. Can you both give us a little bit of background about your companies and talk about what this partnership means from your perspective for the employer arena?
So Medcor was founded in 1984, and since then we have been developing and bringing to employers on-site and telehealth medical solutions focused on not only occupational health, but also urgent care and primary care. So we're one of those rare companies that doesn't bill insurance claims, but we have a close integration and impact on insurance costs. We take care of the minor things appropriately on site or via telemedicine, and that allows companies and their benefit plans to really focus their resources on the things that need the specialists in the off-site care. So that's turned out to be valuable to a lot of companies. That industry has grown over the last few decades and expanded. We serve all of North America, so we're in Canada as well as in the US and in all 50 states. Over time, we find other companies in our space that are really good at what they do, and that's probably a good segue to say, well, one of those is Workrite, and maybe Nick should take it from there.
I think similarly, our focus is in that same space, that same narrative, where we're trying to impact workers' comp claims without directly billing insurance and trying to care for the worker, ideally before they know they have anything going on. Our focus is prevention. We use a sports medicine model to try and empower the workforce and that working athlete to understand what they can do to keep themselves healthy and stay on the job or figuratively on the field, right? And so our team of athletic trainers, physical therapists, and sports medicine professionals combine to drive this attitude and model of prevention that pairs exceptionally well with Medcor services. I think in the most basic sense, we're a little bit more heavily focused on that prevention standpoint and less focused on the after incident stuff, but both of us do parts in both. And I think collaboratively, it really just extends the reach we have to care for the well-being of the worker.
That's absolutely correct. There's a continuum here that fits really well. And I wish that we could say that this partnership came out of some deep, creative, strategic planning process. But like so many things that work out well, it came from listening to your clients. And several customers over the last few years hired both of us separately. And we found ourselves with mutual customers. And as Nick said, there's a little bit of nervousness. There's some overlap in what we do. And like, hey, is this going to be competitive? But both companies are very collaborative in nature. And that's kind of in both of our DNA. So we got to know them really quickly. We found ways to integrate our services kind of organically. And then the move to transform that into a formal partnership was much more deliberate and strategic. But it started with customers that found us each, put us together, and we found that there were synergies. And where Nick's team is super focused and really good at prevention and the model he described, we're really good at putting nurses and medics and nurse practitioners and physicians on site, depending on what's needed, and handling the treatment and the return to work and the referral management and OSHA surveillance and urgent care and kind of wrapping that in. But the prevention side is more their area of expertise. And where there's overlap, instead of seeing that as competitive, we see that as the start of where the integration is. And that's how we got together. It was really a process of listening to both of our customers saying they may be onto something here.
You had no idea that your customers were really just making a match made in heaven or a blind date.
Well, and also this is not then something theoretical where we think it's going to work.
Right.
And we strategically said, hey, we think you're good at what you do. We're good at what we do. Let's put this thing together, and I'm sure the market will love it. The way it's evolved is the market chose us both. And it's been several years. We've been working together in several sites for several years. And now what's coming about is a formalization of what's come about naturally. So we have a high confidence that it's going to work because it already has.
Right. What does the future look like with the two of you? Is it a one size fits all? Can I have Workright or Medcor separately, or is it one package? And tell us how that works.
I think you can have all of the above. And at the end of the day, it naturally is a true partnership that we're not trying to bring multiple solutions. But if the market's saying we want just one of these solutions, we can offer one of those solutions. At the end of the day, we do think we're better together, but we also recognize there's going to be avenues where certain needs are required and it's not going to be the whole package. And so we will be able to fly one united flag that allows us to go and serve in a package, and then similarly, if the need's less, we can approach in that way as well. So it's a little bit of both.
You've got these two cultures that are coming together, working for employers across the country that have a need for on-site presence. What I feel like I hear you saying is that you're addressing what has become known as total worker health in the industry. Does that resonate? What does that mean to you? What offerings do you now have that you didn't have before?
Yeah, that's absolutely the case. Both of us take the approach of following the evidence, an evidence-based approach to medicine, and we're both data-driven. It has to actually work. There needs to be an ROI. There's obviously a lot of customer service involved in the delivery of both of our services. You have to communicate well with your patients. You have to understand their needs. You have to take the time to listen, and we're there. We're right in the clinic and accessible in the work site. And Nick's team is out in the floor on the manufacturing line, coaching and looking for opportunities for improving body mechanics, looking at ergonomics and the great things that they do. And if there is an injury or an illness or an OSHA surveillance program, then they're coming into the clinic and we're taking care of them. The cultures are very well aligned in that sense in terms of our value set and our approach to medicine. And even though Workright's a little bit younger than we are, we're still pretty nimble in terms of pivoting and adopting new things. And they're pretty stable in terms of the consistency. I think we bring the synergies include we've got a big infrastructure for scaling already. And that's something that they can lean on. And they've got a freshness and a nimbleness, and that's something that we can lean on. And those two things really come together really well. Nick's right. It's not a one-size-fits-all, right? People and organizations have different needs. So in consultation with their broker and with their plans, they may find that one of our solutions fits well in a location and the other one fits better somewhere else. So the partnership is mature enough and both companies are doing well on a standalone basis that if that's the case, it's not going to bother us. But we also see that the continuum is improved for total worker health because there are people who get an ache and a pain. They get something that is bothering them. And there's an early symptom intervention now with Nick's team on the front end where it wasn't really an injury yet. And we have an opportunity to refer back to them. So there's bilateral protocols. So somebody comes in with an injury, it's not something that needs referral offsite or needs serious care from us, but we want to keep it from becoming worse. We can refer it to the on-site athletic trainer for their work. On the other hand, somebody might come to them where it's more serious and they need care, and that can come back to us. So those two things together, I think, create a broader continuum for the worker. And at the end of the day, we both remember, our teams know we're not treating injuries and illness. We're treating people. And that makes such a difference, right? It's the total worker. And to a large extent, it doesn't matter if you sprained your ankle over the weekend working in your yard, or if it happened on the stairwell in your workplace or on the line. The best medicine to heal your ankle, you're going to get that from our combined partnership. And compensability and causation, those will get worked out by the health plans and that'll be fine. But you know what? It's easier for them to work it out when we don't bill insurance. So we remove a lot of the frictional costs and we put the focus on the person that has the symptoms and we'll take care of them. And so that makes the continuum effective.
A couple things that I'd add to that, and I fully agree, and Curtis illustrated it so well. But when we think of the well-being of an employee, our focus is to try and understand. And from day one, like Workright's mission has always been to put a dent in healthcare to prioritize prevention over treatment. And there was an element of what we've done where we knew we weren't able to finish the job. And honestly, a part of prevention is tertiary prevention. It's taking care of issues today so they don't become bigger ones down the road, which is filling in with that primary care focus and some of those other things that Medcor does really, really well. And so our ability to pair up that longer continuum of care from the time an employee enters the workplace to ultimately the time they leave is really exciting here. The other thing I'd add is we had to make the decision as organizations, do we do it ourselves or do we partner? And what ends up being the better choice in that space? And both groups had to go through that process. And honestly, we had some of those discussions together as well. And ultimately, where we landed was if you look at a business, you can't multi-focus exceptionally well. I mean, I think of like the hospital systems, it's a good analogy because you got your groups here. But think of the urgent care and emergency rooms in a hospital system. It's where they interface with the public the most, right? That's where they touch the most lives, but it's a cost drain. And as such, anytime we've all gone to the urgent care or emergency room, they're not nice, they're dirty, they're crowded, they're slow, inefficient, all of those things. On the contrary, if we've ever had to have any sort of orthopedic surgery or a surgery center, they're always super nice, very fancy, very attentive, but it's because it's a profitable segment of the business. That business has to determine where they put their focus. And for a hospital system, that tends to be on surgery centers, things of that nature, because they're cash flow positive and better returns. On the flip side, you have organizations that have built their whole business on urgent cares. And if you go to one of those urgent cares, much nicer, much cleaner, much more efficient, because that's their sole focus. And the point being is businesses are going to hyper focus on the area that they control best. When we looked at partnering, we recognized that there's a divergent focus in these spaces. And ultimately, we could say we do it all, but the reality is we're probably going to be really good at one thing and then bolt on some of those other things. And at the end of the day, we knew that's not what's best for the customers. And so what we did instead is we said, all right, let's take what we're best at and pair that with Medcor, who's best at that. And together we've got two really strong strengths to take to the marketplace. And we, frankly, don't think that's out there in the marketplace.
So, besides tapping into total workers' health, what are the other synergies that you are bringing your shared clients? I can imagine that recruitment and retention is something important that you're also hitting with total worker health. But can you talk about some of the other values that you're bringing to your shared clients with this partnership?
Sure. I think there are many. One that I would touch on, and it ties into this concept of the total worker health, is we've talked a lot about occupational health, and we certainly make a very strong, both of us, impact on workers' compensation. But the services we both deliver are equally valuable for personal health and non-occupational needs. And so, again, that's a way that we're addressing the total person, and the benefits accrue to the organization, but also to the individual patient. Because if they are able to get the services they need on site conveniently without leaving work, their pay isn't interrupted, and the company doesn't have a loss of productivity by having an employee leave, right? It's hard to get appointments, you got to take time off and go and access the traditional medical world. And so there's productivity benefits. And then the employees benefit also because we're not charging copays and deductibles, right? They just come in and the focus is all about what's going on with you and how can we help you. The patient experience just changes dramatically compared to what is normally the first step is, what's your insurance? Can I make a copy of your card? And now the first step is, hey, how are you? What's going on? How can we help? And so the biases and the administrative experience are very different, and it allows us both to focus on the whole person. One synergy, I think, that ties back to that decision of buy or build is so often you hear about, you got to make that decision, we're going to buy or build. Well, it's buy, build, or partner. And that third piece often gets left off because people want to do it all. They don't want to share. Why would have somebody else? Because they're obviously going to have a big chunk of the revenue. Why don't we try that ourselves? Well, if you're honest with yourself, you're going to come to the conclusion that Nick described. It's hard to be an expert at everything. And even if you could get there, it's going to take time and it's going to take treasure. And during that time, your clients are going to go somewhere else potentially. So again, being client focused, this is a way to meet a need and add value rapidly versus trying to build it or buy it and implement it separately. And so we have existing customers who, now that we have this partnership and are sharing it through our marketing teams respectively, there's a lot of interest. People are saying we want to learn more about that. So this is a way to bring additional savings to our respective existing customers with more velocity than to wait and then compete with each other for that. The solution comes and seems to flow more naturally.
Curtis mentioned earlier the fact that while Medcor has been around for a long time, multiple decades, that they're still pretty nimble. I think that's a very true statement in that is we search for what's next. What are those new opportunities? We say recognize the opportunity. Similarly, they operate that way as well. And so from their clinical affairs teams to their operations folks, all of those people are trying to look and see what else can we do to make this a better situation for the overall health and well-being of the workforce. And so there's been alignment on various different initiatives. There's been upstream strategy discussions on how do we continue to better serve and better care for the worker. And there's truly an alignment between both groups in that space. So it is exciting to have the size and depth and capacity or capability of Medcor, but still have that nimbleness of almost of a startup.
And of course, for the employer, that has to be a tremendous calling card for attracting and retaining talent, no matter where they are, but certainly if in locations where either it's not conducive to travel to get to a physician or it impacts employees' pay. So I want, both of you have gained tremendous reputations in the marketplace. You're working with some of the most notable brands in our country. And it's interesting. I guess I did not really think through how you all have been working together for years independently before this relationship formed. So I'd love, as we wrap up the show, are there any success stories that you want to share of how this partnership has really impacted somebody from start to finish?
I think at the end of the day, we had a fairly large employer group that was trying to learn how to do all their protocols and processes, right? And we were both brought in to this work environment, and with a new EHS leadership team to that group, we were part of that transition, right? And as we started working together and collaborating together, initially there was times where it would feel very siloed and segmented. And quite frankly, we started aligning and collaboratively leading stand-ups where our Medcor WorkRight teams were organizing the communication back to the EHS group. And from an opportunity to engage the workforce, it started increasing. And out the door, the recordable injuries have gone down. And more specifically, I think the authority we have with the workforce and the trust that we've built there to be able to collaboratively care for them has risen substantially. And so obviously from a growth perspective, service levels have increased since then, and discussions for expansion to other facilities has increased. All of that stuff has been good. But I think most of all it's came because we're serving the people well and it's being noticed.
I think I'd share two examples. One's micro and one's macro. On the personal patient level, there have been several cases where our respective teams have engaged with individual patients. And I think very clearly a few cases where individually it was not evident what the true situation was. But when both of us got involved, like, hey, I have this case, what do you think? Right? We discovered in some cases there were some mental health issues that were pretty acute, and we were able to intervene and get the right care. And there are a few cases like that where it's become pretty clear that getting a more total picture of the health early on can allow for interventions that, I don't want to be dramatic and say, okay, we prevented a suicide in those cases, but we definitely prevented a more severe progression of the conditions before an intervention would have been recognized. So we are seeing individual cases where things that are on a really bad downward track are being caught earlier. And some of that is because the two clinicians are saying, hey, can you take a look at this? And that collaboration at the patient level is generating some really good cases in that sense. On a macro level, we've talked a lot about how we're aligned with each other and we don't bill claims, and that makes us transparent and kind of avoid conflicts of interest. What we're learning and proving is it also allows us to align with any health plan and any broker and any risk plan because we don't have a stake, either of us, in the offsite referrals. Since we don't depend on claims and we don't have any financial tie off-site, there's often some resistance, and rightfully so, skepticism from brokers who have that fiduciary responsibility to look out for their employers and their plan, and employer leaders who are like, okay, this sounds great, but what's the impact going to be on our plan? Because they're typically the plan owners. And the point here is the impact is positive. Because we don't have financial ties to anybody off-site, It means there's no conflict of interest between us. We have no bias, and we'll use the resources when referrals are necessary, we'll use the plan. And referrals aren't often necessary because we're both so good at what we do. We appropriately capture and resolve the cases we see, but we also early identify the cases that are serious and get them to the right level of care in the right time frame, all within the umbrella or the enterprise of that employer's plan. So there isn't a disruption of the resource that they already had in place. We make it better.
It sounds like this partnership is out of this world. And I see behind Nick, it might look like a character from Star Wars, but I think it's his kid behind you in a picture. And I'm wondering if, Nick, you are partnering with Curtis because of his relation to Star Wars, which I would love to dig into as we kind of wrap up our call. So putting you on the spot, Curtis, can you share one fun fact with us?
Well, beyond my dog being named Yoda, it might be interesting to know that when I was younger, I would say long, long ago, not necessarily in a galaxy far away, but definitely long, long ago, I worked in publishing, and I had a role in writing and editing and bringing to market a number of Star Wars branded materials, including one of the first source books. So that was a long time ago, and it's a collaborative process with a lot of really creative minds that I fully enjoyed at the time and look back on very fondly. And it's nice to see some of the stuff that we generated back then is still in the lexicon today and being used.
Very cool.
You really are changing lives. And the vernacular. That's pretty remarkable. Well, thank you both. We are at the Granite List are so fortunate that we've had a longstanding partnership with WorkRight and are so proud of the work that they do. And now so thrilled that Medcor has been brought on the scene as a partnership together with the two of you. We really do applaud you both for taking on a new aspect and a true aspect of total worker health. And we can't wait to see how it unfolds across the country as you help employers and employees one person at a time. Thank you both for being on the show, and thank you for tuning in to another episode of The Granite List Live.
Thank you for listening to this episode of The Granite List Live. Access our entire library by visiting your favorite podcast venue or subscribe on our site, thegranitelist.live.